It worked. The appliance worked. In this video, I'm going to be revealing the results I got from the appliance I've been using with Dr. Estrabillo, the treatment we've been going through, and updating you on my mewing results since the last episode in this series. So for those of you who don't know, growing up, my face grew into this long and narrow shape because I was a mouth breather. So that's why I've been going through this treatment with Dr. Estrabillo to bring my mandible forward, to help me look better, improve my posture, improve my breathing. First, I'm going to give a quick recap of the appliance and what it was supposed to do. Then I'm going to share my personal experience, what actually happened, and the difference it's made in how I look and how I breathe and my posture. And then I'm going to talk about what's next for me in my self-improvement journey if you guys are interested in what I'm doing next.
If you look at Ryan right now, his ear is still pointing backwards this way. So that tells me that his head is rotated. The fact that his head is rotated back, automatically the jaw actually is rotated as well. That will make his back teeth touch more than the front teeth. The angle of the jaw, he's actually forced to open his jaw because his upper teeth and the back teeth are healing because of the rotation of the head.
This is confirmed by my bite analysis. What I'm showing you right now is called a T-scan, which measures the force of the bite on all of the teeth. You can see that mine is very focused on the back teeth, which further confirms what he was talking about.
So what we want to do is actually, we want to derotate the head as Licia and Ryan do their exercises to correct the forward head posture. But once the forward head posture is corrected, the back teeth are going to be freed up. Okay? So now what we want to do is we want to swing that jaw forward so that this long face height right here is going to get shortened and the angle of his jaw is going to actually get less deep.
So one thing to note with this appliance, as Dr. Estrabillo explained, it's raised a tiny bit only on the back molar. But what that does is it means that the only teeth that are making contact are going to be the back teeth. You can see that there's essentially a gap from all of the other teeth. The reason we're doing that is because we're trying to correct my bite so that when we remove the appliance in 3 weeks, what's going to happen is my bite is going to naturally adjust, which will make more room for my tongue and swing my jaw forward. So again, the idea of the appliance is that while I was wearing it, it created more vertical space in the back of my teeth, allowing my lower jaw to come down and forwards, which would create more room for my tongue as well. Now, I was supposed to wear the appliance for 8 to 12 weeks while doing stretches to improve my posture and head position, to adjust to the new position of my bite and temporomandibular joint, or TMJ. After the period of 8 to 12 weeks, what happened was that the TMJ in my bite and posture had stabilized. So now when I removed that appliance, my teeth were touching only at the front 2 teeth. Then there was a gap between my molars at the back teeth because that vertical height increased, and again the joint and my posture had adjusted to that. Now, the point of the next phase of treatment is that we just left it so that the back or molars could super erupt. Now, what this means, super erupt, just means that the tooth comes out of the gums. Whenever a tooth is not making contact with another tooth or surface, it will super erupt, meaning it will continue to come out of the gum. That's why if someone has an extraction and there is no opposing tooth, that tooth will continue to erupt into the space where the other tooth used to be until it meets another surface. Now, the point of this is that the teeth are going to super erupt so that now the molars have more vertical height, which is essentially replicating what the appliance does. Now, after this happens, I will have achieved a stabilized result, meaning that my mandible would be further down and forwards on less of a steep slope. The back teeth have more vertical height, increasing the vertical dimension and bringing the TMJ into a comfortable position. Also, since the mandible has now shifted forwards, my tongue would be more forwards against my upper palate or maxilla, and now the maxilla in theory would come forward as well over time. So that is what the treatment was supposed to do. Now let's talk about what actually happened and my experience now that I've gone through this process. Now, the main things I'm going to be talking about in terms of my experience are firstly the improvement in the way that I look, my jaw, my facial shape. Then I'm going to be talking about the improvement in my tongue posture and position from this appliance, and then my airway, and lastly I'm going to be talking about my body posture, so let's get right into it. So my jaw, my lower jaw, my mandible has definitely come forward and is less on a steep angle than it was before. The angle has decreased and it has come forward, and you can see that in my before and after photos. I'd say that's the most dramatic improvement that I see and notice in terms of my appearance. But also these jaw muscles, my masseter muscles, have gotten stronger from me wearing this appliance. And that was just an effect of the way that the appliance works, which I'll get more into later. Also, I've noticed an improvement in the way that my nose, my eyes, my cheekbones look. That's just a result of my tongue coming forward is already beginning to change the position of my maxilla. And I noticed this because I also noticed that my teeth are beginning to change. My upper jaw is getting wider. Obviously, this isn't this video is just me explaining what I noticed, my experience and the photos. And I'm actually getting another CBCT scan done in a couple weeks. So when I get that, I'll be able to get the actual measurements and have an actual more scientific analysis of the before and after. Now I'm going to talk about the tongue position. So basically what I had is like a hard tissue restriction, which means that because my maxilla and my mandible were both retrognathic or too far back, it didn't allow my tongue to come forwards as much as it could. As soon as we allowed that mandible to come down and forwards, what happened is the tongue was able to go with it. What I felt is as soon as I had that appliance in, my tongue came forward. It was pushing more against my upper palate. It was easier for me to breathe through my nose, which I'm going to talk about in a minute. But now that I have the appliance off, I really notice that my bite is shifted to the front teeth and my tongue is more forward and up against my palate. Now obviously the idea is over time that increased force will cause my maxilla to also shift forward. I've already seen that happening. I'm going to talk about that in a minute. Now in terms of airway and breathing, all the stuff about appearance and the jaw and posture is all great, but I've really noticed an improvement in my airway. And for those of you who don't know, breathing through your nose is extremely healthy. It'd probably be more accurate to say breathing through your mouth is extremely unhealthy. I have other videos where you can see why that is. Ever since I've had this treatment, it's amazing how a few millimeters of tongue space can make a world of difference in terms of your airway. I literally feel like my nose is like double the size it was before, especially when I'm sleeping at night. It just feels like I can breathe so much more easily through my nose because there literally is more space in my airway. The size, the volume of my airway has increased because my tongue is no longer restricted in that airway. But I'm sleeping much better. I feel much more energized, relaxed. And these are the things that happen when you breathe through your nose for several reasons, because it warms the air to improve the oxygenation of your muscles and your organs and stuff like that. Again, I don't want to get into this more. I have other videos about this, which maybe I'll link to. But now moving on to posture. So as you guys may know, you can't really look at your posture as an isolated thing. All of these things work together when it comes to, the shape of your jaw, the position of your tongue, your airway, your TMJ, and your posture. It's all related. My posture has dramatically improved. You can see that my head is in a more upright position. It's one of the main things that I notice. What happened before I had this appliance is that I would try to improve my head position, but I would only be able to improve it to a point and then it would relapse. And the reason for this again is because the maxilla and the mandible are retrognathic, meaning they're pushed too far backwards. The reason why I wasn't able to improve my posture is because I had this limitation there. What this means is that the tongue is restricted as well, right? And it impacts the TMJ. Because if the mandible is too far back and up, like posterior and superior, What that means is that it's jammed into the socket. And when the condyle is too far pushed into the disc like that, then that is what oftentimes causes TMJ issues. So I would notice this. Whenever I'd improve my posture, it would push my mandible too far up. And then I'd start getting clicking in my jaw, it'd be uncomfortable for me, and it would relapse. My posture would relapse. So what happened is, I had this appliance, right, and it brought my mandible down and forwards, which was more comfortable for my TMJ. Now this slid forwards along with my tongue. So now when I improved my posture, it was able to be in a stabilized position. So my head was able to be in a more neutral, stabilized position in the long term. And this is something that happened almost right away when I had the appliance. Okay, so now what's next? What is next for my improvement on this journey? So what am I doing? There are a couple things. With Dr. Estrabillo, now that my tongue is more forward, I'm doing myofunctional therapy to continue to strengthen and improve my tongue suction, my lip seal, things like that, to naturally continue to expand and push forward my maxilla. As I said, because the mandible's forward, the tongue's forward, in theory, the mandible should continue to expand and grow into a more forward position. Now, a lot of dentists disagree on this. Some people don't think this is possible. Your bone is done growing. Others believe that bone remodels at every age, and the soft tissue, basically the hard tissue, the bone, follows the soft tissue. So if the tongue is more forward, the bone will remodel to adjust to that. Now, I personally do believe that the bone will change over time. How long? That's a different story. That's a different question. And that's something that I'm personally interested in. How will I continue to progress? Like I said, I've already noticed it. We're gonna need to back that up with scans and evidence. Oh, and one other thing is that what I'm doing now to continue to improve my posture and my tongue naturally, a lot of you guys watching this could do. If you don't have a structural limitation, as in if you really don't have a narrow, high palatal vault, or TMJ issues or something that you need to see a dentist for, you could do this at home. And that's why we created the online program, which I'll link to, bestfaceforward.com, so that you can do the myofunctional therapy and posture exercises every day on your phone to improve naturally by yourself. So if you're in that position, I encourage you to go sign up for that. The other couple things I'm looking at is, one, I have a tongue tie, posterior tongue tie, and that's again a soft tissue limitation. Now, a lot of dentists I've spoken to say it's very important to get that release done, and I'm probably going to do that. And the reason it makes sense to me is that, you know, if your tongue is limited in its mobility, it won't be able to push all the way up against your upper palate the way that it potentially could and should. So that's something that I want to get done. I'll post video for you guys following that and how to test if you have a tongue tie. The second thing is I'm considering a removable appliance such as a DNA to help to speed up the expansion of this. Like I said, I have access to it. Some of you might not, and I hope to help you to get that if you're looking for it in the future. I know that not everybody will. But I am considering doing that to document it for this channel and also just to have that experience for myself. Again, the way that I look at it is I don't need to improve these things, but I do want to. I mean, I kind of think the best investment you can make is in yourself. So if this is something that's going to improve my posture, airway, how I look for the rest of my life, then it's like, yeah, I'm going to do it. I want to do it. And so that's the way I look at it. So thank you guys for watching this video. I hope that this helped you. I hope this information helped you. I hope you learned something and maybe you consider doing this treatment yourself. A lot of people have reached out to me about doing this kind of treatment. And again, I'm trying to find a lot of good dentists that I can refer people to and put on my website. But thank you for watching. There's going to be more good content coming soon. I appreciate it. I appreciate your support and thank you.